I'm David Goldstein, President of Health Options Worldwide, and if this is your first time joining one of our webinars, we do this the first Tuesday of each month, and if you have been with us on the prior webinars, thank you for being back with us. We appreciate it. So today we're gonna talk about wellness strategies, and in particular, why is it that wellness programs are getting such traction and gaining so much popularity? And the simple reason is that what they do is they really increase productivity, decrease absenteeism, reduce healthcare costs to employers, and drive profitability. They actually really do work, and there's a lot of good reasons for that, and we're going to talk about that in a little bit. The main thing is if you don't have a wellness program, you need to get one. But more importantly, you need to get one that works, and that works well, and that drives employee participation. So, as you can see on the slides, these are some of the most common risk factors leading to chronic diseases. And what's interesting to note is that a lot of studies show that chronic illnesses, such as these that we see, heart disease, diabetes, colon cancer, etc., account for 75% of all health costs. And the typical American diet is responsible for most of the preventable diseases. In fact, according to the National Center for Health Statistics, about 2/3 of the population is overweight, with more than 1/3 of those classified as clinically obese, and the numbers are rising. This obesity, the cholesterol, the heart disease, this is preventable, and with a program in place, you can curb some of these costs. A study conducted by the University of Michigan found that overweight and obese people, on average, incur up to $1,500 or more in annual medical bills than people that have healthier weights. And unfortunately, these folks that are obese have a greater likelihood of having health issues such as heart disease, stroke, diabetes, gallbladder disorders, cancer, and the list goes on and on and on. Again, preventable. Now, one area that doesn't get nearly enough attention is stress. A study reported by the American Journal of Health, employers of 6 large companies found that employee stress costs them about $24 billion, or 8% of their total healthcare costs. And what's scary is when you read into it, factoring in lost productivity and absenteeism, some experts actually put the total cost of employee stress at $300 billion a year. It's amazing. Now, one of the few areas in healthcare that almost everyone can agree on is that preventative medicine, combined with a well-run wellness program, can save a lot of money and make a lot of people healthier. In fact, if you look at a survey conducted by the Continuum Care Alliance, about 84% of employers and health plans have at least one wellness program, and within the next 12 months, about a total of 91% will have one in place. I mean, this isn't going anywhere. It's gaining traction. The problem is that there aren't that many employees using them. Now, the averages kind of vary. It depends on what industry reports you read, but overall, the average employee participation rate is around 10%. Not a very good return for what could be a very good program, and that needs to change. And it's actually not that hard to change. All right, so we talked a little bit about some of the benefits of a wellness program, but what exactly is a wellness program? Let's define it. All right, and these programs, they're supposed to encourage employees and their dependents to participate in programs that are going to prevent or limit the onset of health conditions or chronic diseases. Now, these should eliminate unhealthy behaviors and promote healthy activities such as proper nutrition. They should encourage physical activity and stop smoking. And again, the list can go on and on. But as we've seen, these are the factors that commonly lead to some of the most serious and costly health problems, and usually cause a decrease in the company's productivity, which is why, as we saw, within the next year, 91% of most companies are going to have these in place. Now, there's 2 common types of wellness programs: insurance-based. That's where the insurance company agrees to offer incentives, such as lowering premiums, discounting co-pays, deductibles, things like that, if the plan member agrees to it actually actively does it to change certain lifestyles, behaviors that they do. Now, the other is employer-based. This is similar to the insurance model, but the objective here is to improve employee productivity, reduce absenteeism, and reduce what we call presenteeism. Kind of a funny word, presenteeism. What that means is, well, if you look at absenteeism, what's that? Workers calling out, they're sick, they're not showing up for the day. Presenteeism is where they don't call out. They actually come to work, but they're not really there at work. Yes, they're sitting at their desk or their cube, but they're not being productive. They've got an ailment, whether it's a mental disorder, stress, anxiety, whatever, or they have a physical disorder, whatever the case may be, they're at work, but they're not working. Presenteeism, that's what it is. That needs to go down. Now, again, with the wellness program, some of the advantages of instituting a wellness program that's actually used by employees is that it raises the awareness and importance of health issues. It'll provide information and educate the employees on making better behavioral choices. And in many cases, a lot of these programs will offer incentives or rewards for those that participate in them. Again, very important. So when executed properly, as we keep talking about, wellness programs will save companies a tremendous amount of money and provide the employees with a tremendous amount of a healthier life that they can live. Now, if you look at Johnson & Johnson, here's a great example of a company that invested in their employees, their health and wellness, and over a 6-year period, they actually saved $250 million in their healthcare costs. For every dollar they spent in that 6-year period, they saved, on average, $2.71 per employee. A very large number, given the amount of thousands and thousands and thousands of employees that work for J&J. Well, here's something interesting. Another company randomly chose 185 workers and their spouses. Okay, so they took the 185 people and their spouses. Now, these folks didn't have any prior cardiac problems or anything like that. Just randomly chose them and said, for the next 6 months, we're gonna put you on a cardiac rehab and exercise training program. Okay, so they did that. And at the end of the trial run here, they looked at it and they found that they actually had a decrease in $1,400 in claims per person compared with the prior year. They had a savings of $6 for every $1 they spent in this trial period. Again, the proof is there. These things work. And, as you can also see from the slide here, it's not just the employers that benefit. It's the employees, too. Employees will have better physical health, greater job satisfaction, more positive mental outlook. They're going to have less workplace injuries, more stamina, a better self-image, more self-esteem. They're going to have better employee productivity, a decrease in absenteeism, a decrease in presenteeism. The list goes on and on and on. What does it do? It all results in the employer increasing their profitability. Now, just to reinforce this one step further, Cornell University found that when wellness plans are used correctly, for every $100 invested by the employers, they can save at least $300 a year per employee. Again, for every $100 invested, they're saving $300. And the math is there to really look at, with a 50,000 person company, where can this go? Okay, so for those employees who are engaged to participate in their company's wellness programs, as we keep saying, they become healthier. Their productivity goes up. Their job satisfaction goes up. And what's interesting is so does their loyalty to their employer. You see, employees like it when the companies care about them and care about their health and want them to live longer, better lives. And when they have these programs in place that they're engaged in using, it makes them happier. It makes them feel more belonged and more appreciated. A wellness program that drives employee utilization and drives outcomes will gain, a stronger employee loyalty and will certainly reduce turnover rates. All right, so let's talk about conducting a wellness inventory. So you may have a wellness program in place, but how do you know if it's effective? What do you do? Well, one way that some companies do is they conduct an inventory or gap analysis to determine exactly what services and benefits are available. And the goal of this is to ensure that the company is meeting the needs of the employees and get the best possible return on the investment. Now, the ROI, of course, is measured in dollars and cents, all right? But there's also other factors that go into the ROI, such as employee happiness and productivity and all that kind of stuff. Needs to be measured, though. So how do you do it? First step, identify all areas of the organization that are currently offering these health-related services. You want to find out exactly what is being offered. Who is it being offered to? Are there any out-of-pocket costs to the employees? And if so, how much are they? And is anybody actually using it knowing they have to pay out-of-pocket? Maybe, but maybe not. Goal here is to organize everything into one document and manage that document. Now the next step is to match each service to make sure that it supports the 6 most common treatable health factors. Those 6 are obesity, high blood pressure, high cholesterol, smoking, sedentary lifestyle or a lack of exercise, and mental health. Remember before we spoke about stress and the cost of stress. Well, stress isn't alone. There's also depression and anxiety that's in there as well. These are the 6 that must be in a wellness program. These are 6 areas to focus on that will make employees healthier, but also drive down costs. Now, the next steps are to group all the wellness services to the health risk factors rather. Make sure that everything's addressed, and then ask some certain questions. Is there anything that we're missing here? Certainly, those 6 areas, chronic disease, need to be in there, but are we missing anything else? Are we focusing too much on one risk factor, okay, while ignoring another one? Are we spending too much money and time on making sure everyone's getting their cancer screenings, but are we not putting folks into the smoking cessation or weight management programs? These are the kinds of things that need to be looked at and analyzed. And most importantly, what's our participation rate? How can we increase utilization? Of those that are using it, can we get them to use it better and more effectively? And the list goes on, but those are the main ones. Now we talked about how utilization rates are actually pretty low across the board. But here's something else that's interesting. For those employees that are actually participating, fortunately, the ones that say the employees that are obese aren't participating in weight management programs. Instead, they're participating in smoking cessation programs. And what the experts think this is linked to is all the national attention and money that's been spent educating, anti-smoking campaigns, all that kind of stuff over the years has really been ingrained in the minds of people and saying, hey, we know smoking's bad. And some employees are throwing up their arms saying, hey, give me a program, give me a model, and I want to quit smoking, but help me. They're saying, help me, show me how, and they're doing it. Same's not true with obesity today. But as a country, we are putting a focus and an emphasis on it, and at some point, hopefully it will be. But this goes back into that inventory analysis. Hey, if we're getting a lot of traction in smoking cessation, how can we also put a lot of focus and attention and campaigns into weight management? Those are the things that need to be done that unfortunately a lot of companies aren't doing. So how do you do this? How do you drive utilization, first of all, amongst employees, and then within the wellness programs, how do you drive them so that they're taking advantage of all these programs and not just certain risk factors? Well, the easy answer is using a vendor that specializes in this sort of thing. That's what we do. But outside of that, there's also some things that you can try and do. Since they're the ones using the program, I strongly encourage you to ask your employees to conduct a survey, see what they'd like to see in a wellness program. I mean, you could have what you think to be the best wellness program in the world, but if no one's using it, it's not that good. Or if it's not user-friendly to the end user, the employees, then it's not going to get used, and you're not going to have the benefits. Really, if you want to drive participation, involve the people that are going to be doing it. Secondly, program needs to be reinforced by senior management. First of all, senior managers need to be involved, but it's not enough for employees to see them doing it and using the system. Employees also need to really believe that this is a committed initiative from the company, that senior managers care about their employees' health and well-being. Again, remember, a well-run program will drive a tremendous amount of employee loyalty to the company, but it's a two-way street. Employees really, the company has to meet, and the employees really have to interpret it and say, hey, you know what? My company believes in me, wants me to be healthier. I like that. I feel good about that. I want to use this program. The last thing is you really need to be able to have a mechanism in place that regularly monitors the progress, that regularly evaluates the success or lack of success. Why is it working? Why isn't it working? Either way, what can we do to make this thing better? and hopefully your program has some built-in mechanisms that can do that. Now, lastly, I want to just, talk quickly about, again, evaluating the efficacy of your program. And just with a couple questions that everyone that runs a program really should be asking themselves. One, have your employee absenteeism rates been reduced? Has employee turnover rates gone down? Has your short and long-term disability rates gone down? Has your employee utilization or participation rates gone up? Have your employees' health habits changed for the better? Because remember, again, this is really a behavioral change that we're doing here with employees. We're changing their behaviors to make better value-based healthcare decisions. So overall, one of the key areas to running a successful wellness program is to identify those employees who are at risk and then actively engage them to use targeted programs that'll either reduce or stop the spread of their chronic disease. And if you hit those areas right there, you will have a successful wellness program with successful outcomes and successful results. Now, as you can see on the screen, our phone number's there, my email's there. Please visit us online. Any questions you have, give me a call or send me an email. I'd love to answer them. And thank you for joining us. Really appreciate it. And we'll see you on May 3rd. That's the first Tuesday of May when we do our next webinar. Again, I'm David Goldstein. I appreciate you joining us. Take care.